Hey Ariel, Dr. Shook here. Thank you for sharing this comment to the post. I wanted to reach out to you because I'm getting ready to record a video on the clinical significance and connection between Hashimoto's disease and neurological autoimmunity. This is something that not many doctors are aware of, and almost no patients that I've worked with are aware of this. But the autoimmune process that drives Hashimoto's can also expand to, and more commonly in Hashimoto's than other autoimmune disease, results in neurological autoimmune expansion. Now this can result in a lot of different symptoms. I've worked with people who have vision issues because the autoimmune disease is affecting the back part of the brain, the cerebellum. They also will sometimes have dizziness and problems, almost like vertigo, where the room is spinning because of the way that the autoimmunity and the neuroinflammation can affect the brain. So this is something that for sure can affect peripheral nerves. So for example, one person that I'm working with right now, she has severe trigeminal, so that's the nerves that come off of the brainstem, they're your cranial nerves. She has her fifth nerve, the trigeminal nerve. It goes into different branches in the face and the head, and it's sensory, so it gives, it allows you to perceive touch to different areas of the face. And she has a neuropathy, or a pathology of the nerve, that no one can figure out. And she has Hashimoto's, and so upon testing, we were able to see that she does have neurological autoimmune markers. So basically, the approach that we're taking, so first of all, we're highly suspicious that the problems that she's having with her nerves are related to the autoimmune process expanding to the neurological tissues. So what we're doing is we're taking an approach. The model that I use is the environmentally induced model of autoimmunity. It is a framework that has been built out and theorized and put together by various immunologists who are the researchers of the immune system. And basically what they've identified and what this model is it's a way to look at autoimmune disease to help you better determine what the triggers that the person is having are. And so for example, we have to consider three different things in this model to try and dampen and put the autoimmunity into remission. Number one, are the barrier systems, the immune barriers, are they compromised? So the immune barriers, the most common one that is compromised is the intestinal barrier, the intestinal lining. If that lining becomes inflamed or is permeable, meaning it lets things in the digestive tract into the bloodstream that shouldn't be there, it drives chronic inflammatory responses, and we know it is a gateway to autoimmune disease. It is also something that can perpetuate and drive chronic inflammation. The second thing we have to look at are the immunological triggers. Now, the way that we use this model to help us identify specifically what the triggers are is we can do testing to help us look for antibodies in the blood to identify quantitatively, by looking at markers in the blood, what the immune system is reacting to. And so what we do is we can do testing to look at food protein immune reactions, so looking at food protein antibodies, which antibodies are signals that they're kind of like tags that the immune system makes to stick to specific protein shapes and structures. And once the antibody tags something that is foreign, it's a protein structure, then the other immune cells can quickly identify it and destroy it and eliminate it. So we can actually measure those antibodies in the blood to food proteins, to pathogens. Pathogen is an umbrella term for bacteria, viruses, fungal infections, parasites, and also chemicals. Now, chemicals have a more unique way of inducing autoimmunity, but we can look for antibodies against these things. And if we detect those antibodies, then what we do is we specifically remove those things from the diet and from the environment. If we detect that there are problems with the barrier system, so there's the intestinal barrier, there's the blood-brain barrier, there are the lung system is a barrier, the skin is a barrier. There are many barriers, but we consider those and we support those from a dietary perspective, from a supplementation perspective, and so we remove the triggers. We try to do our best to remove the triggers. We heal the barriers and support the barriers. And then the third component of this model, the environmentally induced model of autoimmunity, is to specifically try and support normal immune system regulatory function. That just means the immune system, typically how the immune system works is whenever it is reacting to something foreign, it creates inflammation to eliminate that thing that is foreign. And then once that thing, the trigger, the thing that is foreign is eliminated, then the immune system comes back down. The inflammation should resolve and it should come back down to a baseline of very low inflammation and in a mode of surveillance. So the immune system can become dysregulated, where that is not something that occurs as it should. Very commonly we see chronic inflammatory responses where the inflammation is persistent and does not come back down to a lower baseline. There's many reasons for that. Or the immune system is never able to mount and create a significant inflammatory response in the first place. And this creates some real issues because the immune system is not working normally. So we look at the factors that can cause immune system dysregulation. So an easy one there is something like vitamin D. If vitamin D is low or if it is insufficient, then it could absolutely be a problem with the immune system and its normal orchestration of that inflammatory response. And this is because vitamin D specifically, it helps a specific type of immune cell called the regulatory T cell to produce, to properly balance the immune response. And so if the regulatory, think about it, the word regulatory, it regulates, if the regulatory T cells cannot properly orchestrate that immune response, then you're going to have problems with the immune system just functioning normally to begin with. So we have to look at the problem through that lens. Are the barrier systems, what is the status, what is the condition of the barrier systems? What are the triggers? And then can the immune system function normally? Is there normal regulatory function? And so when we look at the problem at any autoimmune disease through that lens, we can actually develop a roadmap that is specific and individual to your particular triggers and the factors that we know that drive, that perpetuate, and that can trigger autoimmune disease. So we work to support those and heal them and reverse that process as much as we can to try and dampen the autoimmunity, or if we're lucky, put it into remission. So I wanted to share this with you so that you would have an idea that, so first of all, the nerve signs, it's not just potential deficiencies. That's actually, if you have Hashimoto's and you have signs of nerve issues, neuropathies, or a nerve pathology. I have seen people that have been to 40 doctors, and that's not an exaggeration, and these problems were not detected. And it's not that I'm something special. I've just had an opportunity to learn from people and doctors that have seen these issues. And because I have Hashimoto's and I have psoriasis, it's something that that I have a lot of experience with. So I've seen a lot of different presentations of these neurological manifestations that are autoimmune in nature and that are very common in people with Hashimoto. So I want to share this with you. If you have any questions or you need any help, just follow up with me, and I'll do my best to help you. I mean, I can tell you that some people that aren't in a position to do to work with me one-on-one. I work with people all around the world, all across the United States to help them. But people that aren't in a position to do that, a lot of times they can try things like autoimmune paleo diets, which is just starting with a dietary strategy. I have some free resources that I share with people that so that they can try to help themselves if working with me one-on-one is not an option. But I just want to share this with you. Hope it's helpful, and reach out if you need anything, you have any questions.